Two men aged in their 50s are among the 17 people who have died from coronavirus in Victoria in the past 24 hours, the deadliest day in the state so far. 394 new cases have been reported since yesterday. The Victorian government has also announced a $60 million funding boost for mental health services. For more, Danny Tran is in Melbourne and joins us. So, Danny, just take us through the details there with the latest numbers we've heard today.
Good afternoon, Miriam. So 394 new coronavirus cases in Victoria. Very tragically, 17 deaths, 10 of those linked to health care, bringing our total death toll to 210. And there are 7,854 active cases in the state. Now, it appears there has been some stability in the numbers, which has been alluded to in the last couple of days from the Chief Health Officer and the Premier, and that's because we have moved to much greater restrictions, and also things appear to have been settled down with people trying to do the right thing, people trying to avoid going out when they absolutely don't have to. Here's what the Premier had to say.
To each of those families we send our sincere condolences, our sympathies, our best wishes. This will be an incredibly difficult time for them, and I want them to know that they are in our thoughts and prayers as we continue to do everything we possibly can to deal with this second wave and to get beyond it.
Daniel Andrews there. Now, Danny, what can you tell us about the new mental health funding that's also been announced?
This is a significant boost, Miriam, for Victoria's mental health system, $60 million package, and it's aimed at helping people not only during this pandemic but after it, and the money will be used to increase capacity for Victoria's mental health system to help it cope with more presentations. We heard from the Premier and the Mental Health Minister today that there has been a dramatic increase in the number of people who are presenting with self-harm and who are presenting with acute mental health conditions, and the aim is to reduce pressure on Victoria's mental health system and fast-track the need for more beds. The Mental Health Minister, Martin Foley, had something to say about this. Let's hear from him.
We've seen a 9.5% increase year on year for presentations for self-harm in our emergency departments across all age groups. For young people under 18, we've seen a 33% increase in presentations for people with self-harm in emergency departments. And overall, across all aspects of how mental illness is presented at our emergency departments, we've seen a 23.3% increase in people presenting in those acute settings with a mental illness.
Minister for Mental Health Martin Foley there. Now, Danny, we have the last stage of restrictions in Victoria to come into effect later today. Just take us through what that involves.
It involves reducing the number of staff around warehouses and distribution centres, and the idea is to boost safety. Now, obviously, this will have an impact on Victoria's economy, but the aim here is to make sure that people are as safe as possible and that the pandemic is not spreading through people unnecessarily moving. Look, what Victorians are looking at now is stage 4 completely being implemented across Victoria, and it's something that the Premier says absolutely is necessary to ensure that numbers continue going down and to ensure that while looking towards the end of the year, we can have a Christmas where there are people around the table. It may not be a Christmas that we are used to, but will be something which hopefully people can still get together for. Miriam?
Our reporter Danny Tran there with the latest from Melbourne. Now to New South Wales, where 10 new cases of COVID-19 have been diagnosed in the state. Reporter Ashley Raper has more.
Of these 10 new cases, 8 can be traced. 1 is in hotel quarantine and 7 others are connected to known cases. But there are 2 cases where the source can't be identified, and one of those cases is in a school student at Our Lady of Mercy at Parramatta. Now, of the other new cases that have been recorded today, of note, there has been a second school student identified at the Tangara School in Cherrybrook. A worker at the Bunnings in Campbelltown has also tested positive, and a staff member of the Hornsby Hospital Emergency Department has also been infected with coronavirus.
Now, Ashley, you mentioned there 2 school students who have tested positive. One school in particular has been closed now for 2 weeks. What's the situation there?
Yes, this is in relation to Tangara School. Now, this is a small Catholic school that goes from K to 12, and it is in Sydney's northwest. Now, on Friday, a secondary school student there tested positive, and now a second school student has tested positive, and one of their household contacts. So there's now 3 cases connected to that school. So now all secondary school students and teachers, so from years 7 to 12, have been considered close to contacts, and they have to immediately isolate now for 2 weeks. So the school will be closed, and they've also made the decision to close the junior part of the school, so the infants and primary school as well, even though the K to year 6 students have not been identified as close contacts. The school has made the decision to close the school for 2 weeks, so until Friday the 21st of August, and remote learning will happen. And obviously, Miriam, this is going to be extremely disruptive, especially for year 12 students who later this month will sit their trial HSC exams.